Top 25 care worker interview questions and answers. Starting a career as a care worker requires compassion, patience, and professionalism. Interviewers want to assess not only your skills, but also your empathy, resilience, and ability to provide person-centered care in diverse situations. 1. Tell me about yourself. I am a compassionate and dedicated individual with a strong interest in supporting vulnerable people. My background in care has equipped me with patience, communication skills, and the ability to provide person-centered support. I take pride in building trust with clients, ensuring their dignity is respected, and promoting their independence. My genuine passion for helping others motivates me to go the extra mile. I believe my personal qualities and practical experience make me a strong candidate for this role. 2. Why do you want to work as a care worker? I want to work as a care worker because helping others brings me a strong sense of purpose. I enjoy making a positive difference in people's lives by offering support, comfort, and encouragement. This profession allows me to use empathy, patience, and problem-solving skills daily. Care work also offers opportunities for continuous learning and development. I see this role as more than a job. It's a chance to impact lives positively and contribute meaningfully to the community. 3. What do you understand by person-centered care? Person-centered care is about tailoring support to meet each individual's unique needs, preferences, and values. It focuses on respecting their dignity, encouraging independence, and empowering them to make choices about their care. It means listening carefully, valuing their opinions, and considering their physical, emotional, and social well-being. By treating every person as an individual, we create a supportive environment where they feel safe and valued. Person-centered care builds trust and ensures high-quality support aligned with each person's lifestyle and identity. 4. How do you handle stressful situations in care work? I remain calm and focused when faced with stressful situations. I prioritize safety, assess the circumstances, and take appropriate steps to support the individual while following organizational policies. Deep breathing and clear communication help me manage stress effectively. I also seek guidance from colleagues or supervisors when needed, ensuring teamwork plays a role. Afterward, I reflect on the situation to improve my responses in the future. Resilience and adaptability help me maintain professionalism under challenging circumstances. 5. How would you deal with a difficult patient or service user? When dealing with a difficult patient, I stay calm, respectful, and patient. I listen carefully to understand their concerns, showing empathy and validating their feelings. Often, challenging behavior is a way of expressing unmet needs, so I try to identify and address underlying issues. I use de-escalation techniques and maintain consistent, compassionate communication. If necessary, I involve colleagues or supervisor for support. My priority is always ensuring the person feels respected while maintaining a safe environment for everyone involved. 6. What skills do you think are essential for a care worker? Key skills for a care worker include empathy, patience, strong communication, and adaptability. Organizational skills and attention to detail are important for managing tasks and documenting care accurately. Problem-solving abilities help in responding to unexpected situations calmly. Teamwork and reliability ensure smooth operations, while compassion builds trust with clients. Physical stamina is often needed for practical tasks, and emotional resilience helps in coping with challenges. These skills combined create the foundation for delivering safe, effective, and person-centered care. 7. Can you describe a time when you worked under pressure? In my previous role, I supported several patients simultaneously during a staff shortage. I prioritized tasks by identifying urgent needs first while ensuring no one was neglected. Clear communication with colleagues helped us coordinate effectively. Though it was demanding, I remained calm and focused, maintaining professionalism. At the end of the shift, all patients were safe and cared for appropriately. This experience taught me the importance of time management, teamwork, and resilience in managing pressure successfully. 8. How do you ensure dignity and respect in care? I ensure dignity and respect by treating every individual as unique, listening carefully, and valuing their preferences. I encourage independence whenever possible and respect personal choices, even if they differ from my own. Confidentiality is also key to maintaining trust. I use respectful language, provide privacy during personal care, and communicate clearly to avoid misunderstandings. My approach always involves patience, empathy, and professionalism, which ensures individuals feel valued, respected, and safe while receiving high-quality care tailored to their needs. 9. How do you handle confidential information? I understand confidentiality is essential in care work. I never disclose personal information to unauthorized individuals and ensure records are stored securely according to data protection regulations. When discussing cases with colleagues, I share only relevant information necessary for providing safe, effective care. If I suspect a safeguarding concern, I follow proper procedures, reporting to the appropriate authority. Confidentiality builds trust with clients and families, while ensuring compliance with legal and organizational requirements. Respecting privacy is always my priority. 10. How do you motivate service users to be independent? I encourage independence by focusing on the person's strengths and abilities rather than limitations. I provide support only where necessary, allowing them to complete tasks themselves whenever possible. I use positive reinforcement, celebrate achievements, and patiently guide them when learning new skills. Breaking tasks into smaller steps helps build confidence. By respecting their choices and involving them in decisions, I empower them to feel capable and valued. Promoting independence enhances dignity, confidence, and overall quality of life. 11. How do you deal with emergencies? In emergencies, I remain calm and follow the organization's procedures. My priority is always the safety of the individual and others involved. I quickly assess the situation, take immediate action, and call for assistance if needed. For example, in a medical emergency, I would check responsiveness, call for help, and provide first aid within my training. Clear communication with colleagues and emergency services is vital. Afterward, I accurately document the incident. Preparedness ensures effective, timely responses in emergencies. 12. How do you build trust with clients? I build trust by being reliable, consistent, and respectful. Active listening and empathy allow clients to feel heard and understood. I maintain confidentiality and always honor commitments, ensuring clients know they can depend on me. Patience, honesty, and professionalism help strengthen relationships over time. By treating clients with dignity and involving them in decisions about their care, I create a supportive environment. Trust grows naturally when individuals feel valued, respected, and safe under my care and support. 13. What would you do if you saw a colleague acting unprofessionally? If I saw a colleague acting unprofessionally, I would first ensure no harm is being done to the client. I would address the issue calmly with the colleague if appropriate, offering constructive feedback. If the behavior continued or was serious, I would follow the organization's policies and report to a supervisor or manager. Protecting clients is always a priority, and professionalism must be maintained. Addressing such behavior ensures high standards of care and a safe environment for everyone. 14. How do you manage your time effectively? I manage my time by prioritizing tasks based on urgency and importance. I use schedules and checklists to stay organized, ensuring I meet both care needs and documentation requirements. Flexibility is also essential, as unexpected situations may arise, requiring me to adjust priorities. Communication with colleagues helps in distributing tasks efficiently. I always allow time for emergencies while ensuring daily responsibilities are met. Good time management ensures high quality, consistent care while reducing stress and maintaining smooth operations throughout shifts. 15. How would you support a client with dementia? Supporting a client with dementia requires patience, empathy, and clear communication. I would use simple language, maintain eye contact, and speak slowly to reduce confusion. Establishing a consistent routine helps them feel secure and comfortable. I would engage them in familiar activities to stimulate memory and provide reassurance during moments of distress. Respecting their dignity and focusing on their strengths is key. By remaining calm and compassionate, I create a supportive environment where the client feels safe and valued. 16. How do you stay motivated in care work? I stay motivated by focusing on the positive impact I make in people's lives. Knowing I can brighten someone's day, improve their independence, or provide comfort gives me purpose. I also enjoy building meaningful connections with clients and learning from their experiences. Continuous training and skill development keep me engaged and confident in my role. Support from colleagues and reflecting on achievements also boost my motivation. Care work is challenging, but the rewards and personal fulfillment inspire me daily. 17. What steps would you take if a client refused care? If a client refused care, I would respect their decision while exploring the reasons behind it. I would listen patiently, showing empathy and validating their concerns. Sometimes refusal stems from fear, discomfort, or lack of understanding. So I would explain the benefits of care clearly and offer reassurance. If refusal persisted, I would document it accurately and inform my supervisor. Respecting their autonomy is crucial, but I would always ensure their safety while following organizational policies. 18. How do you work as part of a team? Teamwork is essential in care work, and I value open communication, cooperation, and mutual respect. I support colleagues by sharing tasks, offering help, and being reliable during challenging situations. I listen actively to their ideas and contribute positively during discussions. Flexibility allows me to adapt to different roles when needed. Building strong relationships with teammates ensures smooth operations and high-quality care. Working collaboratively not only benefits clients, but also creates a supportive, positive workplace environment where everyone feels valued. 19. How do you stay professional at all times? Professionalism involves maintaining boundaries, respecting confidentiality, and following organizational policies consistently. I treat every client with dignity, avoid personal biases, and remain calm under pressure. Clear, respectful communication is essential in all interactions. I also ensure punctuality, reliability, and appropriate appearance. Professionalism means being accountable for my actions, learning from mistakes, and continuously improving my skills. By staying consistent in my conduct, I create trust with clients and colleagues while upholding the standards expected in quality care work. 20. How do you approach end-of-life care? End-of-life care requires compassion, sensitivity, and respect. I focus on ensuring the person's comfort, dignity, and emotional well-being. Listening to their wishes and respecting family input is essential. I provide reassurance, maintain a calm presence, and adapt care to meet changing needs. Clear communication with healthcare professionals ensures holistic support. Supporting families through empathy and guidance is also important. My aim is always to make the person feel valued and cared for, providing dignity and peace during this stage. 21. How do you handle cultural differences in care? I respect cultural differences by learning about clients' beliefs, values, and traditions. I ask respectful questions when needed to understand preferences better. By adapting care to meet cultural needs, I ensure individuals feel comfortable and respected. Open-mindedness, empathy, and sensitivity are crucial to avoid misunderstandings. I avoid assumptions and instead listen actively, tailoring my support accordingly. Respecting diversity not only enhances trust, but also promotes inclusivity in care. Cultural awareness is key to providing truly person-centered, effective support. 22. How do you balance compassion with professional boundaries? Balancing compassion with boundaries means caring deeply while maintaining professionalism. I show empathy, patience, and kindness, but avoid becoming overly personal or emotionally dependent. Clear boundaries protect both the client and myself. I remain approachable and supportive, focusing on meeting care needs while respecting privacy. Professional distance ensures objective decision-making and prevents emotional burnout. By combining compassion with structure, I deliver consistent, safe, and respectful care, creating trust while preserving the integrity of the professional relationship with clients. 23. What would you do if a client became aggressive? If a client became aggressive, I would remain calm, avoid confrontation, and ensure safety for everyone. I would use de-escalation techniques such as speaking softly, giving space, and listening carefully. Often, aggression comes from frustration or unmet needs, so I would identify triggers and address them where possible. If the situation escalated, I would seek immediate help from colleagues or supervisors. Afterward, I would document the incident accurately. My goal is always to restore calmness while keeping dignity intact. 24. How do you keep your knowledge and skills up to date? I stay updated by attending regular training sessions, workshops, and refresher courses provided by the organization. I also keep informed about new care practices, policies, and regulations. Reading professional materials and engaging in peer discussions further enhances my knowledge. Feedback from supervisors and colleagues helps identify areas for improvement. Continuous professional development ensures I provide high-quality, safe, and effective care. By staying proactive in learning, I remain confident and prepared to adapt to changes in the care environment. 25. Why should we hire you as a care worker? You should hire me because I bring compassion, reliability, and strong communication skills to the role. My ability to remain calm under pressure, respect dignity, and promote independence makes me highly effective. I genuinely care about making a difference in people's lives and have the resilience required for care work. My dedication, adaptability, and eagerness to learn ensure I contribute positively to your team while delivering excellent person-centered care. I am committed to exceeding expectations consistently. Care worker interviews focus on empathy, resilience, and professionalism. Preparing thoughtful answers demonstrates your commitment and suitability. With preparation and passion, you can show your ability to provide outstanding person-centered care.